The Omicron-driven surge has sent COVID hospitalizations to a record high this week as the U.S. now averages 700,000 new cases a day. Some hospitals are so stretched, they're asking COVID-positive staff who are asymptomatic to come back to work. Joining us to discuss is Dr. Gustavo Ferrer, president of Aventura Pulmonary Institute. Doctor, good to see you. Well, we've got Anjali Kamlani there. Good to see you too, Anjali. But I want to begin with you, Doctor. Would you say that staffing shortages at some hospitals are now at crisis level? And what can be done to alleviate those pressures?
That's an excellent question. We see the number of cases, especially up north. I'm in South Florida. We do not have that kind of situation right now in our hospitals. But if we remember, for the last 2 years, we have a couple of weeks off phase from the rest of the country. Certainly, it is in crisis mode. Remember, we have 2 years going through the same issues now, and now Omicron is one of those viruses that is extremely contagious. So in the past, we did not have that many staff that they were infected by the virus.
Dr. Anjali here. I wonder about the deaths that have been reported. I know the CDC just today reporting a record number of deaths, the average specifically increasing by 40% compared to last week. But CDC Director Dr. Rochelle Walensky said it's largely due to the Delta variant still, as we see that Omicron doesn't necessarily cause as many deaths. Do you feel that that's true on the ground?
That is actually true. We see predominantly mild to moderate cases of flu-like symptoms related to Omicron, that they really tend to linger for days and weeks in many cases. But when we see severe cases, we know that could be and must be the Delta variant. And we do have reports from the CDC that are still circulating in high numbers.
Hey, Doctor, I want to ask you a quick question. Thanks for being on today. There are growing calls in Europe, particularly in places like the UK and Spain also just now, saying that we need to now start treating COVID as more of an endemic. It's something that is here to stay and that we need to live with. Is that something that the US now needs to start considering as well?
That's a fantastic question. I do believe so, that we need to start considering now that COVID-19 is no longer COVID-19, but just coronavirus that is going to be evolving in phases and has become endemic. The data is actually pointing toward that. We will see waves of coronavirus coming up and down. We hope that the next wave, or the waves that are coming through this year, will be more like the coronavirus that we're seeing today with the Omicron. Those are variants that do not produce severe cases of viral illness or viral pneumonia, and we can treat those as a common cold. I think that this is where we need to focus in the near future, not only in terms of planning, but also in terms of research and development of new therapies or new intervention that will help us not only to support the vaccine, but also control any of the issues that we may face.
Doctor, I wonder about the pressure currently on hospitals. I know that, while we do see less severe disease, so not necessarily the need for ventilators and the like, there is still a burden on health workers, specifically because they too are getting infected because it's so highly contagious. Do you think that is going to play a role, in the future, looking at how the workers are able to be scheduled, et cetera, if we do see more waves that put strains again?
Absolutely. I'm going to put you a quick example. Back in around Christmas, my team would run a couple of critical care units here in South Florida. We have projected that we're going to see some cases at the beginning of the month. And after Christmas, on the 26th, our hospital has a significant increase, about 30-40% in the number of cases. So we have to call people that were on vacation to come back and help us. We have to reorganize the whole schedule. And I think we're going to see that more and more playing a role, especially in a variant like Omicron, where people can get infected, staff is getting infected, and putting a lot of pressures in other staff members to cover and help. I think all this has to be taken into consideration as we plan this coming year. We can no longer shout out that we are overcoming the pandemic, and then everybody is going to be caught off guard when the number of cases start going up again. I think we have done that way too often in the last 2 years, and right now is the time to sit down, plan, not pointing fingers, and get the job done.
Doctor, I want to ask you, one of the biggest controversies in this country right now is kids being at school amid the surge and as hospitalizations reach record highs. So the Biden administration is now pushing to make 5 million tests available to children K through 12 to make sure that classrooms stay open. Is that the wisest thing to do? Because just yesterday we saw a mass protest at one of the biggest high schools in the country here in New York City, and students just in tears and saying that they're so stressed that they're in a school with 6,000 kids. And how is that not a super spreader event? Many of them worried about taking the virus back home to their parents and older grandparents.
That's an excellent question. I don't think a one size fits all. I'm in South Florida, and I live near a high school that has 3,000 or plus students. I think about a mile from that school, we have another 300 students. I think each school needs to take it their own needs and evaluate their own needs and introducing the classes back on. I do believe that we need to restart life as normal. I think it's a great idea to distribute test kits that people can do in their homes, and the school can verify that people are getting tested and they're negative as they come back to school, whether they're vaccinated or not, because Omicron does not make that distinction. I do believe that big school, they are going to have a big challenge as it goes through the year, but nonetheless, we need to plan to overcome this and bring it more closer to normality.
Yeah, indeed. You know, the New York City public school system, which is the largest in the country, attendance is now just below 70%. So lots of folks keeping their kids home right now as well. Doctor, I did want to ask you, though, about the rise in hospitalizations. Is that because people are going in with COVID-related illnesses, or is it because they're going in with something else while they need to take a mandatory COVID test and finding out that they're positive?
I think there's a large group that is coming to the hospital with flu-like symptoms, and we find that they have COVID. But for the first time, we didn't see that in the prior waves. We're seeing people coming for other issues, and they get tested, and they are positive. We see that, I would guess, about 5 to 10% in our institutions, and I think that's the data across the country today. And that is attestation that Omicron is highly contagious, and you have a large number of people that do not have symptoms, and they're still going to be carrying the virus. This is extremely important because as contagious as the virus is, if you have no symptoms and you get in a big gathering, you're going to be passing the virus, or we are going to be passing the virus to the most susceptible people that may develop severe disease.
All right, we're going to have to leave it there. We can go on and on with you, Dr. Gustavo Ferrer. Thanks so much, and our healthcare reporter, Anjali Kamlani.